Hello everyone, welcome to Pharma Icon. Today's topic is important topics for the pharma students and easy to remember. In that, first, the following ratios required for the formulation of primary emulsions. What are the ratios we need to know for the formation of a primary emulsion? First, fixed oil. The fixed oils are in the ratios of 4 is to 2 is to 1, which means oil is 4 parts and water is 2 parts and the gum is 1 part. So these are the ratios we need to require for the formulation of a primary emulsion in fixed oils. Whereas in volatile oils, the ratio is 2% oil and 2% water and 1% gum. So by these ratios we need to formulate a volatile oil emulsion. Whereas in the mineral oils, 3% oil, 2 parts water and 1 part gum. So then these are the ratios required to formation of a primary emulsions. Whereas in a oleoresins, the oil is in 1%, water is in 2% and the gum is in 1%. So these are the ratios we need to require for the formulation of a primary emulsions. So emulsions is how many types: oil in water emulsion and water in oil emulsions. Both the phases we need to require for the formulation of an emulsion. The emulsion can be stabilized by using the emulsifying agent. There are various theories to there for the process of emulsification. Next, solubility criteria according to the Indian Pharmacopoeia. What are the solubility criteria we need to require for a forming of any solution? First, the amount of solvent to be required for 1 part of the solute. First one, very soluble. Very soluble means less than one part of the solute we require to form a solution. Next, freely soluble, 1 to 10 parts we required. Next, soluble means 10 to 30 and sparingly soluble 30 to 100, slightly soluble 100 to 1000, very soluble 1000 to 10,000 and practically insoluble or insoluble. The ratio is more than 10,000. These are the solubility criteria according to the Indian Pharmacopoeia. We must follow these solubility criteria for dissolving any substance. Next, types of glasses. There are mostly in pharmaceutical industry we use different types of materials for the packaging of pharmaceuticals. They are like glass materials, plastic materials and metals and wood with the help of wooden containers. The first one, types of glasses. How many types of glasses we need? 4 types of glasses: type 1, type 2, type 3 and type 4. And the material we need to manufacturing of the type 1 glass are highly resistant borosilicate glass. Whereas for the type 2 treated soda lime glass material we need to use it for the manufacturing of type 2 material. And type 3, the glass is made by using the soda lime glass. And the type 4, in type 4 glass we use general purpose soda lime glass. So the test, we need to identify them by which type of material is present in that glass. Either that is type 1, type 2, type 3, type 4. We can easily identify by performing the following test. They are the powdered glass test. And the powdered glass test are the test for the identification of the type 1. Powdered glass test are mostly for the identification of the type 1 glass. Next, water attack test. The water attack test is we need to perform by using the type 2. And then powdered glass test. Powdered glass test is also for the type 3. And for the determination of type 4 we need to perform powdered glass test. Both type 1, type 3 and type 4 we use powdered glass test. Whereas type 2 glass, the type 2 glass we need water attack test. It will be different from all the 3. Next, materials used. First of all, we know the glass materials are mostly used for the packaging of the pharmaceutical. So which types of material are mostly used for the packing of glasses in the type 1 glass? So the first one is powders and buffers and unbuffers. These, what are the materials which are categorized under the powders, buffers and unbuffers. They are mostly used by the type 1. Next, type 2. In type 2 glass, we use the materials like dry powders, buffered aqueous solutions with pH below 7. What are the materials which are below 7? They are mostly used for packing in type 2. And the materials used for type 3 glass packaging are the dry powders, oleaginous solutions, and these are not for the parenteral preparations. Type 3 glass is not for the parenteral preparations. Whereas in type 4, the materials used are not for parenterals, but it is only for the suspensions and emulsions. The type 4 glass we can use it for the manufacturing and packaging of the suspensions and emulsions. Next, important diseases along with their immunological test. Here the disease name and the test name. The first one is a syphilis. The syphilis is the disease can be easily identified by using the Weissermann's test. And the next, diphtheria. The diphtheria can be easily identified by the Schick test. And then AIDS, done by the ELISA. Typhoid Vidal test. And then rheumatoid fever, Rose-Waller's test. Scarlet fever is done by the Dick test. Tuberculosis can be diagnosed by the Mantoux test. Carcinogenicity test can be diagnosed by the Ames test, and the dengue fever can be diagnosed by the Tranquet test. These are the diseases and immunological test to be performed for the diagnosis and treatment of the above diseases. So that's all for this session. Thank you. Please do subscribe Pharma Icon.